We've got major problems in terms of chronic disease in this country, diabetes, heart disease, cancers, and what we do in terms of our physical activity and eating are critically important.
50% of adults are failing to meet physical activity recommendations and 90% of children are failing to meet recommendations. There are real challenges in increasing activity for kids and also their healthy eating.
We know that a mother's weight in pregnancy, a mother's diet in pregnancy, and the kind of diet a child learns to enjoy and prefer will actually set them on a trajectory for the rest of their life and affect their health.
With an ageing population, with increasing rates of disease, there's a cost to the community in terms of the capacity of the health sector to cope with this. There's a cost in terms of increased medication, so we're all paying for this in terms of the bottom line, but obviously individuals who are experiencing disease, individuals living with disease need help, and the research we do feeds straight into that.
CPAN is a world leader in terms of its focus across the lifespan from early childhood right through to older adulthood.
Promoting physical activity and healthy eating and creating the evidence base to inform others who've got to focus on that. CPAN is unique on the national stage and quite unique internationally in that we do draw together both the nutrition and the physical activity.
Trying to develop the evidence base on which exercise nutrition can prevent and manage a whole host of chronic diseases.
We work really closely with some of the key agencies, so government health departments and some of the major non-government organisations like the Heart Foundation.
Our relationship with CPAN is really important to support our messaging and to ensure that we're actually using the research and the evidence to inform the messages that we are conveying, particularly when we're trying to look at ways in which we can influence policies.
Research is a very tough gig. The people currently in CPAN are really high performing people. They're committed into the long term.
My research focuses on pregnant women and their young baby. A lot of what will happen to us in our health is determined during pregnancy, so in utero, and across those early years of life. When we look at kids, we know that by the age of 3, kids' food preferences are pretty much there for the rest of their life. So we've got this great opportunity in early childhood to be making a difference to the health outcomes of these kids.
Whilst we're living longer, many people are living with multiple chronic diseases. One of the programs of research which we've done is to develop exercise strategies to help prevent osteoporosis and falls in older people, where we've tried to look at what exercise works best and how we can get people to actually maintain that level of exercise. And our research is more focused on adding life to years than just years to life.
I'd like to think that in 10 years CPAN will have continued to grow and thrive.
For us to continue to focus on prevention is important, but also on treatment and how we can improve the quality of life.
Putting an evidence-based program out into the community that the end user can actually benefit from.